Recognizing type 1 diabetes. Type 1 diabetes happens most often in children, adolescents, and young adults. They're usually slim. The symptoms, such as excessive hunger, are caused by high blood sugar. The symptoms are often severe and develop very quickly over a few weeks. Even though the young person eats more, they will start to lose weight. Another common symptom is an increase in urination throughout the day and night. A parent may notice that a child has more frequent trips to the toilet or may start wetting herself. Then there is often increased thirst. The child will drink large quantities of fluids. She'll become very tired, weak, and lethargic. If the condition is not recognized, the person can get severely dehydrated, have rapid breathing and fruity breath, then go into a coma and even die. There were several symptoms that we didn't recognize right away and didn't put together. For example, she was eating a lot, and yet she was getting so thin. We thought she's going through another growth spurt. Then she was thirsty a lot and going to the toilet a lot. And she was extremely tired. We thought she's not getting enough rest. She's tired and needs to go to bed earlier. We did not realize that these are classic symptoms of type 1 diabetes. We were looking at the symptoms individually without realizing there were several things going on at the same time that were related. Classic signs of type 1 diabetes are excessive hunger and weight loss, fatigue, thirst, and frequent urination. It took us several weeks before we put it all together, but when we did, it was classic. She had it. It's easy to see now. We can all recognize this disease if we're aware. A person with these signs needs to be tested as soon as possible. With classic symptoms, a simple blood test is all that's needed. A diagnosis of diabetes is made with a fasting blood sugar more than 126 or a sample taken any time of more than 200. Sugar in the urine also means diabetes. In type 1 diabetes, the body no longer makes insulin. The young person will need to give themselves insulin every day for the rest of their life. Insulin is the only treatment, and it must be injected. Once the young person starts insulin, all of those symptoms go away, and they will feel back to normal. It will require adjustment and hard work, but if they take good care, the child can have a long, happy, healthy life with diabetes. Remember, type 1 diabetes happens most often in young people. Classic signs are excessive hunger and weight loss, fatigue, thirst, and frequent urination. Quick recognition can save a person's life.